As part of a project funded by the Health Foundation, we are piloting a service where patients experiencing back pain are able to self-refer to a specialist Royal Free London clinician in their local GP practice. The service aims to improve patients' experience and quality of care by ensuring they receive the most appropriate treatment from the most appropriate clinician as soon as possible. Patients can self-refer to the back pain service or can be referred by any healthcare professional working at the surgery. During the consultation, the advanced clinical practitioner will carry out a detailed assessment of the patient. They can order investigations such as MRI scans and X-rays. The patients report how useful it is to see their images and have a diagnosis and clear explanation of why they are experiencing symptoms. The clinicians can offer advice and resources regarding self-management or can refer the patient to other services such as physiotherapy, pain management, weight loss groups, supported exercise groups, or list them for surgical procedures.
Well, I tried everything essentially. I've had acupuncture, I've been to lots of different osteopaths, chiropractors. Felt after a while, if I'm being honest, that I wasn't actually getting anywhere at all. All I was doing was going in, giving them money, and coming out of there not feeling really any better and not knowing what was actually wrong. You were the first person that actually said, I think this is actually what's wrong with you and this is what we're going to do, and that's why it's just been so great.
Through the back pain service, I've managed to manage my condition now completely. I do the exercises every day. I stretch before I get out of bed in the mornings, and that's allowed me to be far more mobile. Yes, with the back pain service, my confidence has grown completely. I now don't panic when I get a slight twinge or anything like that. I think of doing the exercises, and that's helped me to manage my condition.
Well, I think the main difference is saving on the GP appointments. Patients can self-refer or they can be directed to the service via the receptionist, thus saving all our GP appointments, or a lot of them. Having the clinic in the surgery 4 days a week, although that was a lot of room space, it meant that there was continuity and patients could be seen really quickly. From the GP's point of view, so many of the clinics that run here, they then need further input, which is really frustrating. Results and follow-ups, further investigations, but the back pain specialists can do all of this themselves. They can assess, they can order, they can interpret their own investigations, prescribe, and then it just saves on the GP's time. So the GPs were really up for this.
Our patients have really given us positive feedback about being able to see members of the team and really appreciate the sort of input which the team have given into their problems with back pain.
My experience at the back pain service at Fairbrook it's wonderful. It's really improved my back pain.
Brilliant, to be honest. Just, for me, it might sound a bit over the top, but life-changing.
And I was really, really grateful to be able to, at last, see that this on the MRI, to see what my injury was, so that now I know how to look after myself. And I won't be going to anybody to manipulate it, because it could do more harm. So I'm really, really grateful for this clinic, and I went out feeling really, really happy.
Not only has the service delivered good experience for patients, actually we've been able to evolve it by actually moving it from a plan to a service which is working on the ground.
At the halfway point of the project, the back pain service is able to demonstrate a very high level of patient satisfaction and a more streamlined and cost-effective referral pathway between primary and secondary care. In the first 6 months of the back pain service, a total of 305 new patients have been seen. Of these, 100% were either extremely likely or likely to recommend our service to friends and family. We compared the management of 50 of the back pain service patients to 50 GP-managed back pain patients. 90% of the back pain service patients were seen once and discharged, as compared to 52% of the GP patients who were seen once and then discharged. The GPs referred 12% of back pain patients to secondary care, whereas the back pain service only referred 2% of patients to secondary care, and these patients were directly listed for spinal injections. patients seen in the back pain service waited on average 12 weeks from their initial consultation to spinal injection, in comparison to an average of 31 weeks prior to the back pain service starting.
Hopefully the back pain service at Fairbrook will set a precedent for all musculoskeletal services in the future. It's so important that patients are seen by the right person in the first instance, because hopefully this will save money and time, because patients are referred for physiotherapy and investigations efficiently and appropriately. And if it's okay for low back pain, then there's a potential for musculoskeletal services to use this model and develop across all services.
When I go to the hospital, I have to go on the bus because there's nowhere to park in Barnet. So this, this is accessible for me to come to the surgery. So it would be very helpful if it stays here.
We feel confident that our patients with back pain are getting a better service, which is probably what we're all here to do, is to try and improve outcomes for patients and give better services.